My name is Sarah Gatlin, and my partner's name is Shelby Corrier, and we did our project on autism spectrum disorder. So, what is autism? Autism or autism spectrum disorder, ASD, refers to a broad range of conditions characterized by challenges with social skills, repetitive behaviors, speech, and nonverbal communication. According to Centers for Disease Control, autism affects an estimated 1 in 59 children in the United States today. ASD includes autistic disorder, Asperger's disorder, and pervasive developmental disorder, not otherwise specified, or PDD-NOS. So some of the myths of autism include people with autism are intellectually disabled. The truth is that oftentimes autism brings with it just as many exceptional abilities as challenges. Many people with autism have normal to high IQs, and some may excel at math, music, or another pursuit. Another myth is people with autism can't feel or express any emotion, happy or sad. The truth is, autism doesn't make an individual unable to feel the emotions you feel, it just makes the person communicate emotions and perceive your expressions in different ways. Another myth is vaccines give children autism. The truth is, although the more noticeable signs of autism begin to show up around the age that many children receive their first shots, which is around 2 years old, this does not mean the vaccines cause the autism, as home movie cases studies have revealed signs of autism before children receive their shots. Another myth is people with autism can't understand the emotions of others. The truth is, autism often affects an individual's ability to understand unspoken interpersonal communication. So someone with autism might not detect sadness based solely on one's body language or sarcasm in one's tone of voice. But when emotions are communicated more directly, people with autism are much more likely to feel empathy and compassion for others. So what causes autism? Well, we know that there's no one cause of autism. Research suggests that autism develops from a combination of genetic and non-genetic or environmental influences. These influences appear to increase the risk that a child will develop autism. However, it's important to keep in mind that increased risk is not the same as cause. For example, some gene changes associated with autism can also be found in people who don't have the disorder. Similarly, not everyone exposed to an environmental risk factor for autism will develop the disorder. In fact, most will not. Incidence and prevalence. In 2010, the overall estimated ASD prevalence was 14.7 per 1,000, or 1 in 68 children that were 8 years old, according to the U.S. CDC and Prevention in 2014. It has been established that prevalence varies by gender and race ethnicity. The CDC study found that prevalence was 1 in 54 among males and 1 in 252 in females. So obviously it's a lot more common in males than females. So signs and symptoms include, but are not limited to, the core features of ASD include impairments in social communication and language, related cognitive skills, and behavioral and emotional regulation, and the presence of restricted, repetitive behaviors. These core features are significantly influenced by an individual's development level of language acquisition, for example, pre-symbolic, emerging language, and conversational language, and the level of severity of the disorder. In addition to these core features, sensory and feeding issues may also be present. So methods used to identify ASD are variable. In most cases, a stable diagnosis of ASD is possible before or around a child's second birthday. Screening typically includes a norm-referenced parent and teacher report measures, competency-based tools such as interviews and observations, a hearing screening to rule out hearing loss as a contributing factor to communication and behavior difficulties. The diagnostic evaluation for individuals at risk for ASD typically includes A relevant case history, including information related to the child's health, developmental and behavioral history, and current medical status. A medical evaluation, including general physical and neurodevelopmental examination, as well as hearing and vision testing. Medical and mental health history of the family is included as well, and a comprehensive speech and language assessment. Assessment may also include evaluation of the potential benefit of using augmentative and alternative communication, or AAC, to facilitate functional improvements. In addition, diagnostic evaluation may include genetic testing, particularly if there is a family history of intellectual disability or genetic conditions associated with ASD, for example, Fragile X syndrome or tuberous sclerosis, or if the child exhibits physical features suggestive of a possible genetic syndrome. Metabolic testing if the child exhibits symptoms such as lethargy, cyclic vomiting, pica, or seizures. So, effects on oral, motor, and feeding. Children with autism are 5 times more likely to struggle with eating issues compared to their typically developing peers. Some of the medical conditions may affect children with ASD, such as chronic abdominal pain, gastroesophageal reflux disease, or GERD, constipation, or food intolerances. Postural issues may also interfere with eating. Low muscle tone, for example, can make it difficult to maintain upright seated position while eating. Autism-related sensory aversions are another common reason for eating problems. So if they don't like the texture of something or the smell, they may refuse to eat it just because that sensory overload is occurring.
Some people with ASD may have problems with planning or executing movements. Some people have impairments with their gross motor skills, and this would impact their balance, body awareness, and motor control. So this could impact activities like playing sports, riding a bike, going on hikes, or their ability to grasp objects or carry heavy objects for a long period of time. Some people have difficulties with fine motor skills, and these involve the smaller, more detailed muscles, such as the hands. So this would impact their ability to sign their name, button buttons, play an instrument, knit, anything that's not weight bearing and more detailed. ASD can impact every aspect of language, every domain of language, and depending on the severity of the diagnosis, um, different aspects can be more heavily impaired than others. It's more individualized as autism is a spectrum. So some people may find impaired acquisition of words, word combinations, and syntax, and this may fall back to the social aspects of how we learn language. And as these are decreased, language learning is more difficult for these individuals. Their initial words are often nouns and attributes, and words that represent social stimuli like people's names, mommy, daddy, brother, sister, and verbs, up, um, want, are often delayed for these individuals. The child will often go through a period where they will lose some of their words in this regression period, where they will seem to have a lot of progress and then revert back to an earlier state in their language learning abilities. They may also have problems with pragmatics and the social cues that are involved with language and understanding things like tone of voice that come along with that, and eye contact, and maintaining those other aspects of language besides the specific words and syntax and order that we're putting the words together in. They may also have problems using language in broader ways. They rarely comment, request information, acknowledge or listen or describe events. Narration um, and learning more details about a situation often aren't as important for these children as other children. Receptive abilities tend to be lower than their expressive language abilities. So this means that they can produce language, they can produce more sentences than often they would understand. And this is goes back to their social um, and language learning deficits. So they may also exhibit echolalia, which is the mockingbird effect, where they're um, imitating the speech of those around them. And it can be immediate, such as repeating a question. Um, if their mom asks them, "Would you want more juice?" they may answer, "Do you want more juice?" as an affirmation that yes, they would want more juice, or delayed. And in delayed echolalia, this is where certain individuals that may memorize large chunks of commercials and movies would repeat those verbatim. They may also exhibit that pronoun reversal, structuring their sentences like questions as they're hearing that stimuli come in. They may also have difficulty developing their narrations logically and put details that aren't necessary and may be irrelevant to the theme of the story, which would make comprehension harder for their communication partners. They often don't establish frames of reference, saying who she is, he is, and would just use those pronouns without giving them a reference. And maintaining chronological order. They may start in the middle of the story and go to the end and then jump back to the beginning, again, making comprehension of these narrations so much harder for the listener. They may have abnormalities in their prosody. Those with Asperger's often have monotone, robotic prosodies for their speech. Some people with autism have problems controlling their volume and may speak too loudly or too softly. And others may have abnormal stress patterns that aren't found in English. They may have difficulty understanding the suprasegmentals of other people's speech, the tone and emotion, and reading on those body language and facial expressions to find the emotional aspects of people's utterances, to pick up on things such as sarcasm and the emotional state of their conversational partner. They may have difficulty maintaining those social etiquettes and may be perceived as rude by the people that they're talking with, and may often have trouble taking turns, talking too much or too little, interrupting often. They may have difficulty understanding figurative language and sarcasm, taking things too literally, and may struggle with comprehending indirect requests, such as, "Could you help me take out the trash?" And they may not see that that's, "I would like for you to help me take out the trash." They may be socially distant from their peers, and disruptions in their routine may cause intense distress for them, and they may fixate on certain topics. So, some of the treatments that are proposed for autism spectrum disorder um, largely target social communication and the language impairments themselves, and aim to modify the behaviors and improve an individual's quality of life and increase their social acceptance. So, an essential outcome for this treatment is to um, improve their ability to develop their relationships, maintain relationships, function in everyday life, and um, most comprehensive programs for individuals with autism help to train the parent and caregiver as well. So SLPs establish ongoing partnerships with families to develop meaningful learning opportunities, provide information, teach strategies, and offer feedback for those individuals. So not only is the child learning, but that learning is going to be reinforced when they go home. So clinicians need to recognize and integrate goals that embrace the family's cultural and linguistic communication values and preferences when developing these sorts of treatments. Because if you're not sensitive to their culture at home, then they're not going to be prone to implement that. You need to make sure that your approaches are individualized for the needs of that specific patient and their family. So, some more aspects of treatment. Um, Setting goals based on their assessment data is usually recommended to try to target the core deficits in their ASD and focus on initiating spontaneous communication and functional activities, trying to increase their engagement with other people, help them start more conversations, and be better at returning conversations and keep those interactions going. Helping them to generalize what they've learned in therapy across activities, environments, and communication partners is also important. Using different forms of communication, such as spoken language, gestures, AACs, um, less technologically advanced picture boards, speech generating devices, or written language are also encouraged in this population, as different communication partners may present different communication challenges for these individuals. So, more familiar people may understand their gestures and certain noises that they would make and what those would indicate, but an unfamiliar partner may need them to use gestures and picture communication to help augment that. It's important to consider family priorities as we select intervention goals and see what's most important for them at home. So if he's really struggling with introducing himself and the social aspects of his ASD are most alarming for that parent rather than his linguistic abilities, then we would need to focus on that first and then go back and help him out with any other kind of vocabulary or any other kind of structural deficits he may have with his language. Um, and it's important to also incorporate their culture and their linguistic and personal values into the activities that you're planning in therapy, not just those that you plan for the parents at home. You need to use a range of approaches for enhancing communication skills along a continuum for behavioral and developmental. So, this means that as our clients have different um, needs and they have different challenges, for them individually, as autism is such a spectrum, we can't use the same treatment for every single person. And we have to really look at what's the biggest issue for this person and which of the treatment um, intervention skills that we have in our tool bag would best meet that person's needs. So, what's the outlook for those people who have ASD? So, there's no cure for autism, and um, some people see early intervention is crucial for autism and improving um, prognosis for it, improving those social skills and language abilities. So, a good predictor of if you're going to have better outcomes for the child is if they've already begun to have spoken language by age 5. This is very promising, and so early intervention is really important here, as having that early intervention can help elevate the child's language abilities to where they do have speech before 5 and may have better social outcomes later on. So, although core difficulties remain, symptoms often become less severe later in childhood as their socialization increases and their language abilities increase. So, some children with autism become mainstreamed or integrated after years of hard work and intensive training and develop slowly but never lose their diagnoses. So, there are inclusion classes, and some children don't stay strictly in, some children may choose to be in special education classrooms only, and others may choose to have their child in an inclusion type setting where they have some classes with normally developing children um, and then other classes with those with some other form of developmental disorder. Um, and even some people will go sit, will be in classes with normally developing children all the time if their autism is very mild. Those with higher IQ scores tend to make greater progress in their therapy, um, as there are less impairments that would interfere with the ability to teach those strategies to improve their language. So there's no one particular prognosis for individuals with ASD, as it is a spectrum, and their future depends on the severity of their disorder and the amount of support they receive. So someone with a mild ASD but not a lot of parental or other form of support may not have as good of a prognosis as someone who has a slightly more severe case of autism, but intense parental support, because having that emphasis on early intervention and increasing the intervention at home, continuing what's going on in the speech therapy sessions, keeping that going at home can be absolutely amazing for that child's future. So, rates of unemployment or employment and post secondary education tend to be lower for this population. And it's even lowest for people who have ASD and are minorities and people with ASD that come from low socioeconomic statuses. We have also included some links for parents with children with ASD. Um, Below, there are links to help understand some of the early signs of autism spectrum disorder. There are also some links that show what research our government is doing into autism, how it develops, and the outlooks that those with autism have in our society. There are also some links for support groups on a national level and here in North Carolina for those parents. It's often beneficial to see how other parents of those with ASD are coping and helping to integrate their child into society, as this can help make that process more easy for those parents, as not every single parent has experience dealing with autism on a first-hand basis. There's also groups for lobbying for autism to make sure programs that are beneficial for those with autism spectrum disorder are protected, such as the Special Olympics and certain vocational and educational programs for these individuals. So in conclusion, it's important to remember that autism is very variable, and individuals with autism can have different levels of functioning for their mental, socio-emotional, and physical functionings. And some people may have really high mental functioning, but very low socio-emotional, or very low physical functioning, and very high mental functioning, or very high social-emotional, um, but low physical functioning and mental functioning. But it just really depends on that individual. You can't say autism is always going to look like this, it's always going to be this, because no two people are going to exhibit autism in exactly the same way. It's also important that we beware of myths about autism and understand that people with autism are no less people, that people with autism are still capable of feeling emotions, are very competent, and should be treated with respect. It's also important to remember that autism is not caused by vaccines, and we should stress to parents that um, it's not the end of the world. The autism is not the end of their child's life, that they can still have a happy and successful life with ASD. It's important for us to teach early signs to parents and be aware of those early signs so that we can make referrals if we see those in children that we may interact with. It's important that early intervention is pushed for language development and socialization for these children. It's very important to try to make sure that they're speaking by the time that they're 5 so that they can have a brighter future in terms of their social and linguistic abilities. It's also important for us to encourage parents to reach out to other parents with children who have ASD. They don't need to go this road alone, and having a large support group is not only beneficial for the child but for those parents as well. Below are our references, and I encourage you to look at these. I hope that you found something interesting in our presentation, and I know that I certainly did. And I want to thank you for your time.